When Jean Reynolds started suffering with Parkinson's disease in her 80s, she wanted to move to a care home close to her family in South Wales. But navigating the social care system convinced her niece, Penny Lloyd, that drastic reforms were needed.
I think it eroded everybody's energy, confidence. I think it put a pressure on my aunt at a time when she was at her most vulnerable. I think it actually contributed to the very rapid downhill path that her illness took. I mean, I know that Parkinson's, that's the way it goes, but I don't think it had to have been quite as nasty and disgusting, really.
If you're sick, the NHS is meant to look after you and you won't have to pay. But what if you need someone to help you wash or dress in your old age? In England and Wales, you pay for social care if your assets, including the value of your home, add up to more than £23,000. Any less, and you qualify for means-tested help. Last month, the UK government said it would increase the means testing threshold by £100,000 in England. The Welsh Government is still working on its policy. What's more, care costs in England will be capped so no one spends more than £75,000. Again, we're waiting to hear what the Welsh Government's response will be. Charities representing the elderly and disabled want the Welsh Government to go further and design a system that offers more to the least well-off.
Successive governments in England and in Wales have waited a long time to make reforms for this, and we've come close to the past and nothing's happened. This time it looks like some concrete reforms are happening in England, so it's incumbent on the Welsh Government, I think, to now press ahead with it designing its own plans and putting them out there so that people in Wales have equal certainty over care costs as people will in England.
Claire Davies is a lawyer who acts on behalf of elderly clients. She says, for now, the Welsh Government has some breathing space, but it'll need to come up with firm policies soon.
As and when the UK Government start to set out their policies, and the devil will be in the detail, then at that point in time I think the Welsh Assembly Government should have something ready to announce. But at the moment I don't know what they're doing.
A higher means testing threshold and a cap on costs were advocated by this man, Andrew Dilnot. His commission for the UK Government on funding care recommended a cap of £35,000. Wales's Deputy Minister for Social Services, Gwenda Thomas, commissioned her own report. The Minister's report hasn't been published, but Sunday Politics understands it says that introducing the Dilnot cap of £35,000 would cost £84 million a year. That would rise to £190 million by the middle of the next decade. With no tax-varying powers, the Welsh Government depends on the money it gets from the Treasury. It says it needs to see the sums of the policy in England before deciding what the best policy for paying for social care would look like in Wales. Meanwhile, the Treasury is working on the details of how the UK Government will pay for its system. Wales's share of funding will be calculated by the contentious Barnett formula, which sets the Welsh Government's budget. In a statement, the Welsh Government said there had been extensive consultation on paying for social care over a number of years, including through a Green Paper. It says it has looked for a system that will command broad public support. Mrs Thomas is due to make a statement soon. Families like Penny's will be waiting to hear whether it solves a problem that governments in Wales and Westminster have been grappling with for years.